I'm a phlebotomist at Grace Gilbert Clinic. We have patients come in here every day that get blood work done for inside physician or outside physicians. They can get flu swabs done, strep swabs done, they can have urine samples, EKGs done, and then we pass everything on to reference in the back of the lab.
We actually receive the blood from the phlebotomist through our windows here, and we wait till our blood is clotted 15 minutes, and then we put the blood on our analyzer, and this is the 8100 Cobas. So once the specimens come back around and they're resulted, they come back and get capped and put in our analyzer archiving machine right here. And once we archive it, we can put it in our walk-away cooler. We can go and retrieve the specimens in our computer system.
So this is our flu and strep bench. Over here, we perform flu, strep, RSV, and pregnancy serum tests. And all of those samples get brought from the front back here, and we put them in a fluid. And once we incubate it in the fluid, we put it on one of these cartridges, which is read by fluorescence by the Sophia analyzer. So once the Sophia reads it, it tells us whether you have flu, strep, RSV or not.
This is the chemistry department. We have Cobas 8000. We are tied to the automation line, which is the Cobas 8100. When we receive those specimens, they go directly onto the analyzer. It checks the specimen integrity, as well as analyzing the samples. We do chemistry testing, as well as hormone testing, thyroid testing, and vitamin testing. We do roughly 1,000 specimens per day between the two Cobas analyzers. We receive specimens from multiple satellites, as well as outpatient draws that are in-house.
This is the hematology department. This instrument is DXH600 made by Beckman Coulter. We run a complete blood count, a CBC. We load the sample into this cassette, barcode, which has the patient's name, gender, and age. Put it on the instrument. The instrument loads it on. The instrument mixes the sample 11 times and performs the count. The tube comes out over here when the sample is complete, and the results are printed on a printer of the complete blood count.
So this is microbiology. We receive cultures either as a swab or as a urine or another bodily fluid. We set up the cultures and read them at 2 to 3 days to see what grows. We'll then set up a panel and determine what bacteria grows and what drug that the provider should use to treat the patient. Once we look at the plates, we put them on the panel, put the panels in the analyzer, which is a microscan. Tomorrow we'll come in, it should be able to tell us what bacteria it is and the drugs that it's resistant or sensitive to, and we provide that to the doctor so they can know what drug works best for them.
So on behalf of the lab management team, I would like to thank all of our clinical scientists, our medical technologists, our medical technicians, phlebotomists, and receptionists for all they do for our patients. Happy Lab Week, everyone.